Welcome to the Allscripts MyWay version 10.0 in 10 minutes. Allscripts MyWay is an integrated practice management and EHR in one database. It is simple, affordable, and complete. It contains over 20 specialty contents. We are ARA certified for meaningful use and 5010 compliant. Everything you need is considered in one database. During this presentation, we're going to walk through a basic 6-step practice workflow. Review scheduling, check-in, the nurse, physician, checkout, and billing responsibilities. When you first log into MyWay, you'll see the desktop. On the left will be all the appointments in time order for the patients coming in to see the particular provider that day. On the right-hand side at the top, you'll see your message center. That's both for internal messages and external messages. Internal messages from other users, external messages coming from lab interfaces, and refill requests from pharmacies. At the bottom right, you'll see all the provider's incomplete notes, or notes that are open that need to go back and be completed. This desktop can be customized based on their user and their role within the practice. For front desk, we would add eligibility verification. For billing, we would add the access to the clearinghouse for claims management. To schedule an appointment, you're going to select the blue calendar hyperlink. It opens up our calendar window. Each column represents a different physician, or you could see an entire work week view for one particular provider. You can set your appointment templates to have a very distinct day schedule. You could see a consult at 8 a.m., another one at 8:30, followed by post-ops, follow-ups, and pre-op H&Ps. It's very scripted. Other providers have very wide open schedules, as you see in the afternoons. Just depends on the type of patient that calls, what appointment type they're looking for, and they would schedule the appointment type when they book rather than having a predetermined template. MyWay works with either option. You determine the appointment types, the duration, as well as the colors that will appear on your scheduler. Once the appointment is scheduled, they will then appear again on your check-in window. When the patient arrives for their appointment, the front desk is going to select the time and it opens our check-in window. We change the appointment status from scheduled to checked in. Once we check the patient in, we can then go to the account tab and go ahead and post their copay information. At the top, you would see their copays coming from their demographics. We can post the amount, the method, and it would automatically allocate to today's data services E&M line item. At the bottom, you're going to see the account balance. So if there are any prior balances, you can go ahead and post a payment to that balance, which then you would allocate to the patient's oldest balance. We can also verify patient demographics, making sure that they still live at the same address and they have the same telephone number. Once we choose OK, my patient Donna Dobson is now checked in and time-stamped. This is now an indication to the nurse that the patient is ready to be taken back and begin the clinical portion of their exam. The nurse will open up the chart note by selecting Open and Create Note and begin Full Note Composer. They would enter the patient's vitals or pull them in through a vitals device and then go to the chief complaint. In the chief complaint section, they would choose the appropriate system. Here we chose ENT, followed by the appropriate symptom, which is sore throat. Once the patient has their sore throat selected, it then will, through intelligent navigation, guide them through a list of appropriate questions and responses based on that complaint. Here you see on the left-hand side, under category, all the questions we can ask. Each question has a corresponding column. Here for location, we would select where the pain is located. Under quality, describe the pain. Onset of symptom, when it began. Also at the bottom of the screen, you'll start to see the total number of points charted. This will calculate the appropriate level of E&M code at the end of the visit. Once the nurse completes the HPI for that particular symptom, they're going to go to history. If this patient has been seen in the past, you'll see that some of their history items, such as medical, surgical, family, social, meds, food, and drug allergies, are all blue. That just tells me I have information already built. All I need to do is just verify that there are no changes. If there are no changes, I just simply select a check mark next to each one of these items, and it will add a statement to my chart note that you have reviewed the medical history. If there are any changes or additions, I would go ahead and make the appropriate change. Once the nurse is finished, they're going to select Save and Hand Off the Note. When they choose Hand Off, they're going to determine where that patient is now located, what exam room they're in, and it would update on the provider's window with the appropriate exam room. This lets the provider know that Donna Dobson is now in exam room 1 awaiting them. The provider has two options. They can go straight into the chart note as the nurse did and go ahead and update the information, or they can open what we call a one-page summary. The one-page summary will show you key information regarding this patient. You can see their health maintenance reminders, so if there's anything that they're due for. Health maintenance reminders are built based on a patient's age, gender, medical history, and medication history. For example, females you can remind to have mammograms, males, PSAs, diabetic patients, hemoglobin A1Cs on given time intervals. So you would see if your patient's due for something. Under that, we see their current medications, followed by active problems, and then a copy of the visit note as created by the nurse. We see that the nurse had that she has sore throat. It's in the left paratonsillar area. It's constant and scratchy and began 3 days ago. When the provider is ready to go ahead and start treating the patient, they're going to select the date at the top left, and it then opens up Full Note Composure where the nurse left off. In the physical exam section, instead of having to go in and chart all of your normal findings, you can select just one check mark here. That would pull forward what we call a group norm. It would be your basic, alert and oriented ×3, well, nurse will develop to no acute distress. You would then open the appropriate system and chart any negatives. So here we chose oral cavity, pharynx, and larynx. The negatives here were mobile tongue benign, oral mucosa was clear. If there were any positive findings, we could select those as well. It comes pre-built with the appropriate findings and descriptions for each individual specialty. One of the key components of MyWay is its ease of customization. So if there's any time there's a specific item in a column, from chief complaint, HPI, through physical exam, every column will have a hyperlink at the top. That hyperlink will open up a customization window. If you would like to add a new description, you just select New. It adds a new description to your list. If you want to hide descriptions, things that you don't normally use, you just put a check mark to the left of each one of those descriptions you wish to hide. If you want to reorganize this list, you can use your A to Z to put them in alphabetical order, or your arrows to move items up or down. Once we complete our physical exam, I go to Diagnosis. In Diagnosis, very similar to your encounter form, you can have Donna Dobson's list. If I select Donna Dobson's list, it'll pull forward all the diagnoses that I've seen her for in the past. I can select which diagnosis I want to pull to today. Under Frequently Used, it'll show you each provider's top 50 diagnoses based on experience, followed by individual categories. And these categories are created by each provider, generally based on their encounter form, for ease of documentation so that you can quickly get to the diagnosis for this particular patient. In this case, I chose strep throat. MyWay also uses adaptive learning, so based on experience, it will remember what are the things you normally do for a patient with strep throat. It pulls forward and says in the past you've prescribed Keflex, erythromycin, Zithromax, or amoxicillin. You can simply select which prescription you want to give to the patient today. Under Services Performed, you can choose the level of office visit. It's guiding us to a 99213. I can go ahead and document my quick strep and all of my results. Lastly, if there was any services you wanted to order, under Services Ordered, I could order a service. These are things that are not performed in your practice that would generate either a requisition to be printed at checkout to hand to the patient and they could take with them, a requisition that you give to your own lab if you do your own draws, and then you could go ahead and draw the patient's lab, including specimen labels, and then go ahead and put in the drop box for the lab to pick up. Or if you have an interface, it can go electronically once you choose lipid panel all the way to the individual lab, and when the patient arrives, they'll know what lab the patient is coming in for. Lastly, it also pulls forward when you would like to see the patient return and any appropriate instructions. Once you've completed your plan, the provider selects Close Note. It opens my checkout window. They go ahead and would automatically have selected Ready to Discharge, so it's going to move the patient to the appropriate place that the patient would now be, which is outside of the exam room and waiting to be checked out. It sends the super bill to the billing department in a status of Ready to Review. It marks the prescriptions as ready to prescribe. Once we choose OK, takes us back to our main window, updates the status again to Ready to Discharge, letting the checkout person know that Donna's on her way out the door. The checkout person will open the checkout icon. It'll give them instructions and remind them of any instructions that you gave the patient, allows them to print a plan, prescription, and a clinical summary for the patient to make meaningful use. It also would tell the checkout person when the next appointment should be scheduled and a hyperlink to go straight to the calendar and schedule that next appointment. Once they choose OK, my patient now moves to discharge. As far as the billing is concerned, we'll go ahead and select Track Super Bills. The billing department would see a list of all the encounters that this provider has finished. Once the encounter is finished, again, it changes the super bill to Ready to Review. So instead of having a paper pile of encounter forms, this is their electronic pile of encounter forms. They choose the appropriate super bill, opens up the super bill, and they review it for accuracy. They want to make sure that there is a payable diagnosis and procedure code, appropriate charges, and then they change the status from Ready to Review to Ready to Submit. This now cues it to go to the clearinghouse. As far as your documentation, you have the option of exporting your documentation to Microsoft Word. It would pull in your appropriate letterhead and then complete the document as you wish. It includes any introductory sentences using the correct pronouns. So here we said that the patient was Donna Dobson. You saw her in consultation today. She presented with sore throat. It's located in the left paratonsillar area. So it's just pulling your visit forward to a documented note. You can go ahead and add additional information to this note and save it to the patient's record. Lastly is meaningful use reporting. If I go to my reporting icon, you're going to see lots of clinical and practice management reports. The one we're going to focus on is the stimulus report. It'll show you all 25 meaningful use criteria. You can see the report name on the left and then the description. It just tells you what does this mean. The first one, allergy list, says that you either have to have an allergy listed or no known allergies selected. You can't just have forgotten in Full Note Composer to document allergies. You have to do this at least 80% of the time. My denominator tells me how many patients that I've seen. I've seen 3 patients. I've appropriately documented all 3, resulting in a score of 100% and passing. You can have no more than 5 red items on this report in order to attest for meaningful use. Messaging is also important. As we mentioned, you can do internal and external messages. If you see the patient through a lab interface, when those lab results come back in, they can either be scanned and sent to the provider's inbox, or as the interface automatically just pulls the result into the provider's inbox, they don't have to be scanned. So it saves that one step. It would show the providers the description, the value, their normal minimums and maximums for each one of these findings. Allows the provider to send a message to the patient, send a message to a nurse, or change their medications or schedule an appointment. As far as imaging, we can also save images to patient records. This is just an image of a patient's throat. We can go ahead and also forward to the provider. The difference with images is it will also send you icons at the top for colors that you can go ahead and annotate on this image any findings. Once again, the same ability to send a patient a message, send a nurse a message, or update the patient's record. We hope this presentation has given you adequate information on the setup and usage of Allscripts MyWay. Please visit our website if you would like to schedule a one-on-one presentation or receive a call from our sales team. Thank you so much for your time and interest in how Allscripts can help meet the needs of your practice.